Sonia Adesara is an NHS doctor and an amazing campaigner and activist. She's been at the forefront of campaigns against NHS privatisation, against on a whole host of issues, and is a well-known voice in the media. It's an absolute pleasure to be joined by Sonia today. Sonia, how are you doing?
Good, thanks. Thanks for picking me up.
Always. So thank you so much for joining us. So we're going to be talking about the crisis facing the NHS at the moment, and we're seeing loads of headlines constantly, news bulletins talking about the crisis in the NHS. What's really going on in the health service right now?
Yeah, so I think sometimes we can get a bit numb to the headlines because we keep hearing these same headlines of worst situation ever in the NHS. We're hearing about waiting times. We're hearing about, A&E hospital waits. And I think the first most important thing to say is that this is something that hasn't just happened. It's been a situation that's been getting worse, slowly worse and worse year on year. And I'd say for at least, I think we've seen a steady decline in the conditions in the NHS over the last 5 years, maybe more than that. And there's been a steady decline, and that corresponds with decline that we've had in funding for our health service. And then I think we've now just got to the point where things are just falling apart. And I think the NHS was being held together by goodwill, by people working in the NHS, just making things work and making things happen. But it now has got to that tipping point where things are just disintegrating. And this is not just also because of COVID. COVID did make things more difficult, but this was happening before COVID. I remember it was I think it was maybe December or January, just before COVID. So it was when it would have been just after the last general election. And I remember that winter, and I was working in A&E at that time, and it was just, it was bad. The situation was bad. And I remember thinking, I think it must have been January, because I remember looking at my phone in our staff room, and I saw a news headline about this COVID virus. At the time, we had no idea what we were going to be hit for. And I just remember saying, I think in a sort of a jokey way to one of the nurses that I was with, imagine if this actually hit us, and we sort of laughed about it nervously, and then it hit. And then, so things were already bad. Things, COVID didn't make things easier. It did not make things easier. And the situation has got worse. And it's a combination of, the main thing is underfunding of the NHS consistently year on year. And that has made working conditions more difficult. We've seen a decline in care, and we've seen a decline in funding at a time when actually the needs of our population, people are living older, people have more health problems. The needs of the health needs of our population has been increasing whilst funding has been decreasing, and as a result, we've seen the decline in standards as we've witnessed.
So alongside all of that you've described, at the moment we've got a wave of industrial action that's taking place within the health service. So you've got the Royal College of Nursing taking strike action across England and Wales for the first time in its history. You've had ambulance workers on strike, and you've got the BMA just starting balloting its members as well for industrial action. What are the big issues that are underpinning those industrial disputes?
Yeah, so I think it's three things, and I think it's firstly, it is I guess the job is becoming more and more difficult as you're trying to work in unworkable conditions. And we know that there is really high rate of stress, really high rate of burnout, really high rate of work-related illness among NHS workers, and that's throughout the NHS. And again, that's something that's been getting worse and worse year on year. On top of that, the pay for NHS workers, we haven't seen, for a lot of NHS workers, they're getting less in real terms pay than they did in 2010. So on top of working conditions becoming more difficult, more stressful, we're having a pay cut. And then thirdly, I think probably people don't think about this enough, but, I guess if you are working in conditions where, I guess you can maybe, as NHS workers, you can maybe put up with hard conditions or put up with poor pay if you feel like you're giving good care. But I think for many of us, we feel that particularly in the last few years, that the care patients are getting is just not good enough. I work in general practice now, and I guess I'm having so many conversations with patients where they're not having their cancer treatment, or they're in severe pain and having to wait like a year to see the hospital consultant. Or I'm seeing patients who I can see that their health conditions have got worse because they haven't had the care that they should be getting. And that is, that's something that is very emotionally quite difficult as a healthcare professional to deal with. And when you're having those conversations day in, day out, you have patients who are understandably angry and upset that they're not getting the care that they should get and that they deserve, then that can make just doing a job quite emotionally difficult. So that's the three things. So it isn't just about pay, it's about working conditions, and it's also about the quality of care that we're given. And I think we just, I guess, because I was part of the junior doctor strikes, and I think it's really important for people to sort of understand that NHS workers, we don't go on strike easily. And this is a cry. This is not a cry. This is a scream for someone to say, for the government to listen to us. And the declining conditions that I talked about, and I've said, it's been going year and year. We've all been, us working in the health service, have seen that decline happen year on year. And we've been speaking up. We have been making noise about it. We have been raising an alarm. We have been saying, this is not good enough. In the last general election, there were lots of NHS workers that was really speaking up, saying, look, when you're voting in this election, look at what's happened to our NHS and think about which party is going to be best to make our NHS fit for purpose. So we have been really speaking out about conditions, and we have been ignored. And when we were doing the junior doctor strikes, we were saying, look, if you don't pay people properly and don't make the conditions better, people will leave. And look what's happened. The reason why we have so many rota gaps is because doctors are leaving. And in general practice as well, like if you look at, I think I saw a stat, I think it's 3 out of 5 GPs are planning on leaving within the next 5 years. Now, these are not GPs that are retiring, these are GPs that are leaving early in career. Now that's not a small thing. These are people that have spent years studying, then years in the further training, spent loads of money, getting to become a GP. They are people that really, I guess, are, GPs in their heart and soul, but they have been forced to this position where they're leaving general practice. And that's because they just, either that they're burnt out, or they know that they're not providing good care, or the situations have got so bad that they just can't endure it anymore. So if people are leaving jobs that they've spent so much training in for, and have spent their, a good part of their life becoming the doctor or that nurse, we have to really stop and listen. So these strikes are just our NHS workers saying, look, please listen to us. Conditions are not good. People are leaving, and that's making the conditions worse. If you're working in, let's say, a practice or a hospital where you don't have enough doctors or nurses, but you have rota gaps, it makes a job even more difficult. So that's what the industrial action's about. So junior doctors, nurses have already gone on strike. Paramedics have gone on strike. Junior doctors are balloting. We probably will vote. Junior doctors probably will vote for strike as well. The cause of that is this government who's been refusing to listen and who have overseen the decline in our health service.
So earlier on in the show, I spoke to John Bosco from We Own It, the anti-privatisation campaign group, about some of the effects of privatisation in the NHS. What role do you think that privatisation has had in the issues the NHS is facing right now that you've described?
Yeah, so I guess we've seen a steady increase in privatisation over the past few years. I guess we saw that increase go up quite significantly under the coalition government, and then under this current government. And I guess people probably don't often know what privatisation is happening, or don't see it, because it's often outsourcing. So what happens is services get outsourced to a private provider, and so you as the patient may not realise that it's a private provider providing that service rather than the NHS. And I guess sort of there are two issues that brings about. Number one is that it fragments the NHS. When you have lots of different things trying to work together, it can fragment the NHS. Secondly, this won't be the case for all private providers, but I guess there is, within the NHS, there is an ethos that we work for the NHS, patient comes first, patient's always our priority. I guess when you've got private companies, the first priority will be to make profit. And then the second or the third or another priority would be patient care. So there have been quite numerous examples now across the country where we've seen unacceptable care happen by private providers. And then it can, sometimes it's not big things, sometimes it can be small things. But, I remember when in my last hospital that I worked in, our patient transport system was done by a private provider, and just small things would happen, but small things that could really impact patients, like elderly patients being left at the front door rather than being taken up to their bedroom, or if we're 5 minutes late with a discharge, then they'll say, okay, we're not doing it, and then the patient then has to wait another few hours to be sent home. So small little things, but they do really sort of can significantly impact when we have frail people or elderly people, the people that use the bulk of the NHS. And I remember speaking to one of the guys that worked for that transport system, and he said he'd worked previously when it was run by the hospital, and then now he was working by this private provider. And he said, look, the reason why is because this company that runs it, because first of all, they pay us really rubbish, and if you're sick, whatever, you don't get paid properly. Secondly, the company is actually normally it's a parcel delivery company. And he goes, the problem is this company thinks patients are parcels. And it's things like that, it's just, these companies don't always see patients as patients. And then that's why you then get decline in care. And then, it just, I guess also, I know there's been lots of talk recently about using private providers to put down waiting lists. That already happens, actually. We already have private providers using to reduce waiting lists, which you may think, fine, that can be in the short term, bring down the waiting list, fine. But you've also got to remember that people working for these private companies, the doctors, the nurses, they are the same people that would be working in the NHS. So you're actually taking workers that would be working in NHS to these private companies, who often, sometimes, particularly for doctors and nurses, they pay more than they'd get paid in the NHS. So you will see a shift of workers, which isn't good for our health service, and it does make it easier to fragment and privatise the NHS in the future. And then secondly, so that's one thing, that's outsourcing. The second thing, the increase in private sector in the health service, is we've seen, particularly in the past recent years, when we've seen a real decline in standards in the NHS, and we've seen waiting times for basic things like hip hop be 12 months. We've seen more, or let's say just to see a hospital consultant, you're waiting one year to see someone. We've seen more and more people who are then choosing to go private. I've seen that in my surgery. And look, I work in Tottenham. Actually, many of my patients are not wealthy, but because they get so desperate, then they are having to forced to pay for surgery or pay for things privately, which is really expensive. And a lot of my patients think it's something that's a massive expense for them. And I find that really worrying, because now we've got this situation where people that can afford to are going private. And that also just destroys the ethos of the NHS, when you've got people that can pay for it getting better care and getting quicker care than those that can't. So that's really worrying, and that's significantly increased in the past 12 months, and that's set to increase if we don't see an improvement in our conditions in the NHS.
My final question for you is, what practical policies do you think that the NHS needs to solve these crises?
Big question. So I'll try and simplify it. I think we need to pay workers properly. The reason why that we have 100,000 vacancies in the NHS and 120,000 vacancies in social care is because NHS workers are not paid properly. So you need to make it a job that people want to do. We need to train more workers, but we also need to make it a job that people want to do. And then also we need to stop the exodus of workers that's happening right now. And make those conditions better. So that's number one. Number two, money is important. Healthcare costs money. And compared to, if you look at European countries, if you look at countries like Germany, Switzerland, France, per person, they're all paying significantly more on healthcare than we do. So they're paying 10 to 15% more on healthcare than we do. So money is important. And it is the underfunding of it. And you can literally, if you look at it, if you look at the graphs, if you look at standards, and if you look at money that's going to the NHS, it correlates quite scarily. So fund the NHS properly. Healthcare costs, but health is important. And I think if we value health, if we value people's being able to contribute to society, then it's something that we really need to invest in and invest properly in. Thirdly, social care. The reason why we have these, we have ambulances queuing for, you know, outside hospitals, the reason why that we have elderly ladies waiting, you know, sometimes 10, 12 hours for a hospital bed is because, number one, we don't have enough hospital beds, but number two, that we have patients that can't be discharged because we don't have enough social care capacity. Now, I believe that we shouldn't just be increasing social care capacity, that we actually need to completely reform our social care because it's not fit for purpose, but that's a, you know, a big conversation, but actually thinking about a care system that works for all of us, and that's fair and that's equal and that's just and provides good quality care for everyone that needs it is really, really important. And then I think, you know, then beyond that, we can thinking about conversations about how to improve our healthcare system. It is, I think if someone's used our healthcare system, and I guess young people often maybe don't realize this, but if you do have a serious health issue, or if you've got multiple health issues, sometimes your experience of the health system can be quite fragmented. You have different people doing different things. It can all be a bit disjointed. And I think, and that is also a result, again, of outsourcing and about the internal market has made the NHS quite fragmented. So having a uniform health and social care system is what, you know, I think what should be the goal, and there needs to be some big thinking about how we do that. And then lastly, you know, I guess health system is one thing, but the issue that we have in this country is that there is a 10-year difference in life expectancy between those that are wealthy and those that are poor. If you look at postcodes, you can see, you know, someone's postcode can basically determine how long they're likely to live. There is a 15 to 20-year discrepancy in healthy life expectancy. So that's the age in which people start to get sick to the point where it affects their ability to work and contribute to society. So 15 years, that's massive, you know, that is purely based on people's social and economic situation that's causing them to become sick, because they are most of the time using the same health service. So we really need to be thinking about what is it that is making people sick, and maybe people, their lifestyle, what is it people's lifestyles that are making them sick. And that was something that really showed up in COVID. You know, the reason why we had really high death rates and higher than most countries in Europe is, yes, because the response was bad, but also because we had a lot of people who had health conditions and chronic health conditions that made them at risk of dying from COVID, but that also makes them at risk of dying from flu and all these other things. So having a real understanding about that and thinking and investing properly in public health, which has actually been cut significantly more than the NHS funding. Public health funding has been completely savaged. So some public health departments have had 50% cuts in the past decade. So investing in public health, thinking about the policies that we need at a local government level and a national government level that allow people to live healthy lives, I think is really important, and should be also, you know, be what we think about when we're thinking about what type of health system that we want.
So I've got a great question that's come through in the chat, which is from Ben Samuel. It's a bit of a political question. So Ben asks, who do you think are currently the main political allies and opponents of the NHS?
Yeah, so I think no one would be surprised if I say the Conservative Party. I wouldn't quite call them allies. And the reason why I won't call them allies is because of what they've done to the health service. The decline in health service that we saw has been under the coalition government and the current Conservative government. And I think, you know, they have watched that decline. You know, this hasn't been a sudden thing. They've watched that decline in standards happen. They've ignored not just health workers, they've ignored the health think tanks, they've ignored the experts. They've overseen that decline in health standards. So I don't think they are a friend of the NHS. I think I can't remember which ones now, but if you look at some of the prominent Tory cabinet people, if you look at some of the books that they've written in their early lives, they discuss how actually they want to dismantle the NHS. They don't like the service that we have. So I wouldn't call them allies. And I'd say, you know, I guess the other political parties are broadly allies. They should be anyways. And you know, the British public are allies. And I think, you know, we know consistently, even when actually standards have been at their worst, the British public support the NHS because they know that actually people I think intrinsically understand the importance of health and intrinsically understand the importance of having a good quality health service to be there for you when you need it. So I think it's just something, it's quite natural that people want the NHS and believe the NHS and love the NHS because it is there for people when they need it the most, and it is there for people when they're at the most vulnerable. So, you know, I think it is politically stupid for political parties to not have policies that will rebuild our health service and make it fit for, you know, give us the health service that we deserve. And that's about, you know, it's not just about protecting it, but it's also about making sure that our health service is giving quality care to everyone, which I think is it's just not happening right now.
Thank you so much, Sonia. It's been an absolute pleasure. Thank you for joining us today.
Thanks. Bye-bye.